The Association of Hearing Instrument Practitioners of Ontario is pleased to present Help Me Hear. How to read an audiogram. A hearing test will determine how well an individual can hear and whether the person's hearing is within the normal range. A hearing test measures the softest level at which an individual can hear a variety of different pitches or frequencies that sound like beeps during the testing. The audiogram is used to document the results of the testing. One can think of the audiogram as a picture of an individual's hearing sensitivity. The audiogram is a graph. Along the bottom, or x-axis, the pitch of each different sound is represented using frequency in hertz. Just as the keys on a piano start with low-pitched sounds on the left moving toward higher-pitched sounds on the right, the frequencies marked on the audiogram start with the lower-pitched sounds or frequencies on the left and move to higher-pitched sounds or frequencies on the right. The numbers shown along the left side or y-axis of the audiogram represent how loud the sounds are and are noted in decibels or dBHL. When the hearing test is performed, the clinician records for each frequency the softest level at which the person hears the sounds. This is known as the audiometric threshold. The audiometric threshold can be different at each pitch and different in each ear. In the audiogram, these thresholds are plotted for both the right and the left ears, using symbols where O represents the right ear and X represents the left ear. The shaded areas shown in our example represent different categories of hearing ability. For example, the area shaded in light yellow represents normal hearing, while the areas below it represent different levels of hearing loss. The further the markings are down the page, the greater the hearing loss. In our example, the symbols tend to go down the y-axis as the pitch or frequency increases, meaning that the hearing thresholds are better in the lower pitches or frequencies and worse in the higher frequencies. In this example, our patient has a very mild hearing loss in the lower frequencies, and it progresses to a greater hearing loss in the higher frequencies. This type of hearing loss is very common and is often seen in the case of age-related hearing loss. Understanding the results. The results of a hearing test give information about each part of the hearing system. If everything appears normal for the patient's age and history, or there is little change from the last test, returning in a year or so may be recommended. If the test shows anything other than normal, the hearing care practitioner can recommend the appropriate solution, which may include medical referral, communications improvement strategies, or even exploring the use of amplification. The Association of Hearing Instrument Practitioners of Ontario is pleased to present Help Me Hear.